Hi, I'm Ethan. Just doing the hot and cold modality contraindications recheck here. So the contraindications for the cryotherapeutic modalities include cold hypersensitivity that causes a rash. So if the patient has a history of getting a rash after using a cold or ice pack, that would be an absolute contraindication. We're not going to use cold for them. If they get severe pain, numbness, or color changes in their skin from the use of cold or ice pack, that's also a absolute contraindication. We got the Raynaud's disease, which is a progressive draining of the normal kind of pink flesh tone color out of the fingertips when cold, and there's a lot of pain involved in that. You can kind of see it flush out. We don't want to use cold on someone who has open wounds because the vasoconstriction can limit the blood flow and kind of healing factor to the area. We don't want to use cold on people who have impaired sensation, so they got some loss of feeling in the area either. That's also an absolute contraindication. And so for heat, we have absolute contraindications include the acute injury. So we don't want to use heat on someone right after they got injured, because that will not help with the inflammation. We don't want to use heat on someone with a decreased circulation. That's also an absolute contraindication. We don't want to use heat on a patient who has a loss of sensation in the area because they won't be able to feel how hot it's getting, so they won't be able to tell if it's getting too hot and let us know. We don't want to use heat on someone who's very young or very old, just because very young and very old people they're a little more sensitive. And we don't want to use heat on someone who has a fever because they're already elevated body temperature, when increased further can lead to a lot of health issues, including death. So yeah, there are our absolute contraindications that you want to make sure you check off before using any of these modalities on a patient for safety reasons.